Hello, my name is Kiva Allen, and today I'm going to be performing a neurological assessment on my patient. Can you please tell me your name and date of birth?
Geraldine Allen, April 9, 1956.
The first thing we're going to do is test her cranial nerves 1 through 12. We'll be performing a series of tests to ensure that her cranial nerves are intact and functioning properly. The first, we're going to check her olfactory nerve. What I'm going to have you do is close your eyes for me. I'm going to put something in front of her nose and have her smell it.
Vanilla.
Vanilla. And it is vanilla. So we know with the correct answer that her olfactory nerves are intact and working properly. Next, we're going to test her optic nerve. Her optic nerve is her peripheral vision. What I'm going to have you do is I'm going to have you cover one eye. It doesn't matter which one. And I'm going to come from the side, and this is testing your peripheral vision. When you see my fingers, I want you to tell me how many you see and when you begin to see them.
2.
Okay? I want you to switch eyes, and we'll do the other side.
3.
Okay? Now, with the eyes, you also have your ocular motor, your abducens, and your trochlear. And all of these nerves test your pupils and your eye movement. So what I'm going to have her do to test her eye movement is I'm going to have you follow this pen light with your eyes only. Don't move your head, just follow with your eyes. Good job. And now I'm going to hold this out, and I'm going to go towards your nose. And again, please just follow with your eyes. Great. Now I'm going to test her pupils. When we test for her pupils, we're testing to make sure that her pupils are equal, round, reactive to light, and accommodating. Look straight, look up, and look. Okay. You have to be able to see your pupils. All right. And her pupils, it might be a little hard to see with the angle of this camera, but her pupils did constrict for me. Now we're going to test her facial muscles. I'll have you smile. I'll have you frown. Okay? And that just tests her facial muscles. And now we're going to test her trigeminal nerves, which are having to do with chewing. So what I'm going to do is I'm going to place my hands here, and I'm going to have you clench your teeth. Okay? And I'm going to place my hands here, her temporals, and I'm going to have you do the same thing, clench your teeth. Okay? Now we're going to test her gag reflex. And I just want you to open up and say ah. Okay? Her gag reflex is intact. Now, I'm going to test your vagus nerves. I'm going to just have you swallow. Did that hurt?
No.
So now we see that she's able to talk and swallow without having any issues. And those are her cranial nerves. Next, we're going to test for her coordination and fine motor skills. For this, I'm going to have you hold your hands up, okay? And I'm going to have you up and down in a rapid motion, okay? Now I'm going to have you do the same thing with your legs. Up and down in motion. Good job. Other leg, please. Okay. And she had no issue performing on the legs. Now, I'm going to test your gait and your balance. I'm going to have you stand up. I'm going to have you hold your arms out. And I'm going to have you close your eyes. And I'm going to have you count to 10 for me. I'm going to have you put your arms down to the side like they are now. Open your eyes. And I'm going to have you count to 10 again. Okay, and you can have a seat. Now, as you can see, she was able to stand for a period of time without any swaying or without requiring any assistance from me. So she does have fine motor and she does have coordination. Now, we're going to do we're going to use our tuning fork, and we're going to test her vibratory responses at her bony prominences. Can you feel that? Now this here, I'm going to try to get this in view. This is her bony prominence. Can you feel the vibration?
Yes.
Can you feel the vibration?
Yes.
Okay. Now I'm going to do this at her knee. And can you feel the vibration?
Yes.
Okay, good. Thank you very much. All right. Now I'm going to do some other tests that are part of our neurological assessment as well. And I forgot to do the acoustic for the cranial nerve, so I'm going to go back and do that. What I'm going to basically do is just whisper something in your ear, and I want you to tell me what I whispered.
Chocolate.
Good job. Now the other ear.
Vanilla.
Good job. Okay. Now we're just going to test her perception. We're going to test how she is with touch. So what I'm going to have you do is I'm going to have you sit back and get comfortable, and I'm going to have you close your eyes now. So what I'm going to do is I want you to tell me how this feels. Okay? Now what I'm going to do is I'm going to put her hand in focus, and I'm going to show you the end of this, and I want her to tell me how this feels. Is that sharp,
Sharp.
pain, or dull?
Sharp.
Okay. Now, we're going to do the same thing again with something different. Close your eyes. All right.
Soft. Soft.
Good job. Okay. Now, I'm going to test her. I'm going to test this to see if she knows what finger that I am working with when her eyes are closed. Okay? I'm going to close your eyes. I'm going to press down, and you tell me which finger I'm pressing.
The last finger. The last. The first finger.
Okay, good. Now we're going to do a 2-point demonstration here. And basically, that's you just take two things, and she's gonna tell me if it's 1 point or 2 points. And again, we're gonna keep this to one side so that I'm not keep crossing in front of the camera. So we're gonna do this. Close your eyes, and I want to tell me if you feel 1 point of contact or 2 points of contact.
1, 2, 1, 1.
Good job. Now, I'm going to have her close her eyes again, and I want her to tell me the shape that I put into her hand. Close your hand. Feel that. What shape is that?
Square.
A square. And yes, it's right. It is a square. Okay, let me have your other hand, please. This is her other hand. And I'm going to put something in her hand. And I want you to tell me what shape that is.
Round.
Okay, good job. Now, I need you to keep your eyes closed. I'm glad you trust me. And I want you to take your hand out. And I'm going to draw on your hand. I just want you to tell me what it is that I'm drawing.
S.
Okay. Other hand.
Circle.
Good job. So as we can see, all her perceptions, her neurological, everything is intact at this point, okay? Now I'm going to test her deep tendon reflexes, and I do have a hammer here. So we're just going to focus on this arm here, and we're going to see if she has some movement when this is hit against her tendon. Okay? As you can see, her thumb and her hand is jumping just a little bit there. And then we're going to do her biceps. And then we're going to do her triceps. And then I'm going to do her knee. I'm going to try to position the camera so that you can see. I don't want it to fall. Okay. So now that we have here, can you see? I'm just going to do her knee. And as you can see, that's intact as well. Now I'm going to move the camera back. Please bear with me. Okay, you can open your eyes. Now we just have a few more tests to do. Now, usually this is the part of the test where the patient would lay in the bed and we would test her abdominal reflexes. But since she's in the chair, I'm just really going to explain what I would do here. And when the patient is lying flat, I basically would take some sort of tool, or maybe even the end of a Q-tip if I had one, and I would just move it up against the umbilicus, towards the umbilicus, and I would just watch for contractions in her stomach to make sure all her nerves there are intact. Also, I would also do a plantar reflex test, and what I would do there is I would start at the ball. Put this up a little bit. Okay, I would start at the ball of her foot and go up in a backwards J motion to make sure that her toes will curl inward. As an adult, inward curling toes is correct. If her toes were to flare out, that is a Babinski reflex in an adult, and that is abnormal. That disappears after a certain age in infancy. As we can see, all of her cranial nerves are intact. Her neurological assessment is complete, and she's pretty much normal. I think that that's it for now. So thank you very much. Have a good day.